But for those of you who don't know me, I'm Michelle van der Westhuizen, and I've got Rachel Maurice here with me. We're both medical doctors. We've known each other probably about 5 years, and she was the one who introduced me to the patches. So she's been helping me learn about all the ins and outs of this new technology that I'm enjoying, and she's got lots of great stories and testimonies. So she'll tell us a bit more about herself here in a little bit and share some of that. But yeah, it was really my trust in her that got me onto the patches. She's very scientifically minded and got a very similar outlook in life in general. And so yeah, thanks Rachel for being here. And really the aim of today is to just introduce you to these patches. And I'm sure there's some people here that know a little bit about them, but some of you maybe know nothing. And then I also really importantly wanted to just introduce you to the concept of light and how fundamental it is in life and in healing in general. And really, like what I've learned over the years is we don't need a backpack of supplements and IVs and tinctures and injections to get well. It's, those things are all useful in certain circumstances, but if we come down to basics, it's really light that activates healing and is regenerative and repairs the body. So yeah, just before I jump in, just a quick medical disclaimer. So both of us are medical doctors, but we're not here to provide medical advice. This is a purely educational presentation. And so this is the patch that we'll be digging in today. This is the Lifewave X39, and this is the flagship patch, and it's been the most revolutionary out of all the Lifewave patches. It's most effective and transformative due to its effect on stem cells. So that's one of its main effects. It's got many of them, which I'll discuss. But we know that stem cells are crucial for growth, regeneration, repair, and then actually age reversal. So yeah, I love this quote. It's simple, but it really encompasses my overall journey and my experience of trying to get myself better first before I can help patients. And I've come a long way in my own healing. I've been through an arduous journey of trying to get well and optimize my health. And it's been challenging sort of every step of the way. But as I kind of learn more and more, I add layers and tools that have helped me. And then I sort of apply that to other people and to patients. And I always love to just try things for myself. I don't like recommending things without knowing that there's at least some potential that they're going to work. And obviously that they're safe for people to use. So just then a little bit more about me. My background is I did my medical training in South Africa. I'm a GP by training, worked in family practice there and in Canada. And then through my own health journey, I kind of got interested in alternative forms of healing. And I transitioned fully to functional medicine about 10 years ago. For those of you who don't know much about it, it's basically like root cause medicine. We're treating the underlying cause, but we're looking at biochemistry. So all of those sort of chemical pathways and how each of the systems link. So it's a big jump from conventional medicine. And this medicine was really transformational for my life and for my career. And it took me in a completely different direction. And I started to see that, healing was possible without just patching symptoms. And so yeah, it played its role, but I also quickly saw that it didn't do the job for everyone. There's a percentage of people who just don't get better. They're doing everything right, but they're just not moving the needle, and or they get better and it's not sustained, or they're just not feeling their optimal self. And so I was one of those people. I probably was about 80 to 85% better. But I still felt like each day was difficult in terms of just mainly energy and my brain function. And, it wasn't to the point where I had to like stop working or anything like that. I kept going, but it was a struggle to get through a lot of the days. And then I had my first child in 2022. And the postpartum physical side of that also hit me really hard. And so sort of trying to climb out of that over the last couple of years. And that's when I stumbled across quantum biology. And quantum biology it just introduced me to the fact that our body and our energy systems, they run on electrons and electricity. They're not just sort of biochemical processes. And the most important thing of that is actually light. Light drives all of these processes in the body. And so if you don't have the right kind of light, your biochemistry can't be optimized. And so that like it clicked for me that that's why the functional medicine approach didn't work for everyone. It's fantastic, but it just doesn't do the trick in all people. And this message sort of resonated with me so deeply that I started right away. I started using the sun as a tool to heal and get more energy, and I started to see benefits even within days on how I was feeling. And that's the beauty of light. Light works really quickly. It's instantaneous information that goes all over the body right away. It's not months of taking supplements and doing all sorts of protocols. So yeah, so then basically when I went on a walk with Rachel, she was telling me about the patches and what they'd done for her and her mom and some other people. And it was an immediate kind of count me in. I just want to try these. And I started them right away thinking I'll sort of figure out the details later. And once I did, and once I dug into the research and looked at all of that, I saw that it was actually very scientifically sound too. And then just briefly before I hand over to Rachel, for me, I saw benefit within 48 hours. I was with sleep and anxiety. Within a few weeks, my energy and brain fog was markedly better. In a month, I had less food sensitivities, less histamine intolerance, gut function improved. And then 3 to 4 months, I started seeing scars healing, scars disappearing. I had some photosensitivity that went away, like night blindness, difficulty with driving at night. That's gone away. And I'm about 6 months in now, and actually pregnant at the moment. And so that's really helped me to keep my energy during this time that's usually can be quite energy draining. So yeah, Rachel, I think I'll hand over to you to let everyone know a bit about your personal experience and what got you onto the patches.
Okay, thanks, Michelle. And I even learned some stuff when you were sharing that I didn't know before about you. So for those who don't know me, as Michelle said, I'm also a medical doctor, and I worked as an anesthesiologist for close to 20 years and left that practice in the fall of 2021. So it's been, yeah, almost 4 years, 3.5 years since I've been working. And in the time, I didn't think that I was going to be gone for very long, but the world was in a bit of chaos. And I was doing a lot of research around a lot of things that didn't make sense to me of what was taking place. And in that, I also stumbled across quantum biology, like Michelle had said, she did. And it basically crumbled the entire foundation of everything I had learned. That's how I felt. I had not gone through the functional medicine pathway, and I was working in the operating room, giving drugs every day. That was what I did, and intubating people and manipulating their physiology. So I was very rooted in the biochemistry and the pharmacology. And so this really changed things for me. And what I was struggling with, which again, this is what helped. Like Michelle said, things happened for her quickly within days. I had low energy and fatigue to the point where I could not keep my eyes open while driving and during the day. So we're not even talking about at night because it can be tiring at night when it's dark. But during the day, I struggled to keep my eyes open, and I was doing a lot of driving because my kids were in high level sports, and we go to different cities. And within a couple of weeks of having learned about light and implementing some really simple practices, my fatigue completely disappeared during the day. I was not getting any more sleep, but my fatigue went away. And so that's when it really hit me. The light went on that like Michelle said, light really is the driver of all of our physiology that is downstream. So the biochemistry, it's not that it's wrong or incorrect. It's just that it's a downstream effect. And when we target things upstream, that's when we can really make changes. So I started doing a lot of deep diving and learning about mitochondria and how light and the water in the body affect our energy and everything. And that's when I came across the patches. It was actually through the Quantum Biology Collective. And I didn't investigate too much at first because I thought they were just another type of technology that was like a red light panel. But of course, I was wrong about that. And it was really a fortuitous sequence of events that happened, that I connected with a woman who was a cardiac surgical nurse for 20 years, and she had been in the company for a year and a half. My mom's health was declining to the point where her doctors were talking about surgical intervention, so heart surgery. And being an anesthesiologist, I know that we can pull anyone through an anesthetic just about, but it's the after effects and how people recover that is really problematic. And what this woman, it was Diane Hunt, she showed me, not just, she didn't just tell me stories, but she actually showed me objective tests like echocardiograms and electrocardiograms of people and changes that took place with, because my mom, the problem was heart failure. She was showing me people's what's called ejection fraction, the amount of blood that is pumped out of the heart, going from 15 to 20%, which is low, that's extreme heart failure, up to 40, 50, 60% within 8, 10, 12 months. And that is not anything that I've ever seen in my entire career in medicine without some kind of artificial device being implanted. And so knowing about light, knowing these patches, nothing going into the body, they were using our own light, which Michelle's going to talk about. It was a no-brainer for me to get my mom on them. And knowing that healing takes time, although we're not conditioned to think that in society, it does take time for healing. I got my mom prepared to use these patches for a good year before she was going to make any kind of judgment on them. But to my surprise, within 2 weeks, she went from having to stop every 2 to 3 steps to catch her breath to walking 4 blocks with me, talking to me, and walking on an incline, which was, I get quite shocking to me because, again, I was prepared for it to take time. Within 3 weeks, she had to have her thyroid medication lowered. She had an increase in energy. And as time went on, she had a lot of skin issues with some medications that she's been on, or she had been on, and they were about 80% cleared up. Her spider veins disappeared, her varicose veins diminished. Her hair is actually now turning dark. It was really white. It's actually now getting kind of salt and peppery. And anytime she would see friends that she hadn't seen in a while, they just thought that she looked like a completely different person because her energy and her just overall vitality, she was just much better. And so for me, I've always been very proactive about making sure that I didn't have to access the medical system if I didn't have to. So I didn't have too many issues, although I did get sick in 2020, in March of 2020, and my brain function took a serious nosedive. And I was trying a lot of alternative things to help with recovery, and nothing really seemed to do anything significant. And it was about 9 to 10 weeks after being on the patches that it completely turned around. I was able to focus because before I was having trouble with word finding, with memory, with articulation, just being able to formulate sentences, never mind brain fog. And things really changed for me after the 9, 10 week mark on these patches. And other things that sometimes we don't think about, we get used to living with, and we don't realize that it's actually a problem. It's an underlying issue. But myself, since I was a teenager, I used to swim a lot, and I got athlete's foot, and the fungus went into my toenails. I was for years on oral and topical antifungals. Nothing got rid of them. So I just resigned to living with them and cutting them as short as possible so that they weren't visible. And it was probably about 10, 11 months after being on the patches, because it's been a year for me. I was looking at my toenails because I got my sock caught when I was putting them on. I was looking to actually cut one, and I couldn't believe I was looking at my toes, and it's about 60% cleared up, the fungus. And so you know, again, that's not something that I would have said, yeah, I've got any health issues, because that's one thing that people will say a lot. Well, I'm pretty healthy. Why would I need these patches? But again, we'll get into that. And so I just started sharing with people around me, and I won't take too much longer, Michelle. I just wanted some highlights. You know, one of my friends who had sciatica for 5 years, it was gone in 3 hours after patching. One of my neighbors who was diagnosed with 3 types of cancer, had surgery, had heart issues. He went from, I mean, he was not able to even walk with, or he was walking with walking poles. He had a patella fracture, and he had so much pain. Immediately after putting the patch on, the pain disappeared, but he had so much more energy. His wife couldn't believe it. They walk around the golf course here all the time now. He went from getting up 6 times in the night to go to the bathroom down to one. He went from sleeping 5 hours a night to sleeping 9 hours a night. He had a condition called trigeminal neuralgia, which is a nerve pain syndrome in the facial nerve in the face distribution, which was so painful. It's actually nicknamed the suicide disease, and brushing his teeth would trigger it. The wind would trigger it. It was gone in 9 days. And there's so many stories that I want Michelle to go on with the presentation, but I can share more afterwards if people want. So thank you.
Thanks, Rachel. That's awesome. Yeah, there really are hundreds of stories. So yeah, so it's pretty obvious to anyone to see that overall health in society is declining. It's not getting better. You'd think with modern medicine and being in first world countries that we should see these things improve. And there's several factors that play into that. The more and more I've experienced it myself and with patients, it really a lot of it comes down to environmental issues. We've got more chemicals, we've got nutrient depleted foods, we're more stressed out, we overuse pharmaceuticals. And then really big factor is that we have more technology and less nature. So we're surrounded by blue light and EMF, and we've got less connection with the earth. And when we're kind of dealing with all these different symptoms and diseases, you know, it can be quite scary. The health system can be frustrating. You know, conventional medicine's great at emergencies, not great with chronic health care. And then even the natural health worlds become very confusing with lots of conflicting sort of advice. And then just, you know, supplements have become the new medications, like, you know, a supplement for every ill kind of thing. And yeah, none of this is really a criticism on the healthcare system, but just, and everyone who's in the system is doing their best with what the information that they have and they know how to do. And it's, yeah, at the end of the day, it's important to find a path that resonates with you. And so, yeah, wouldn't life be easier if you had more energy and could think clearly and didn't ache all the time and essentially just fill in your why here. But for any health related issue or any new thing that you're kind of bringing into your toolbox, you really want to establish your why. Why are you putting in the money for this? Why are you putting in the effort? What's the end goal? What's the lifestyle you're seeking? What do you want your energy for? And once you're informed of all your options, decide what resonates the most, what has the most value. And for me, these patches have been one of the most amazing interventions that I've ever seen, just in terms of it being such a new innovation, using that whole new paradigm of light for healing. So it's really, really high value, and I've seen it to be effective. So I'm just going to go a little bit into, before I dive into the patches in more detail, I just wanted to introduce you more to the concept of light as a healing tool, because this is really fundamental in understanding how powerful the patches are and really understanding what they do. I think when a lot of people hear about them first, it sounds all a little bit far-fetched, and I think it's because we, you know, in conventional and even in functional medicine, like I said, we learn about chemical pathways, and it's not common knowledge to know that light is actually where it's at, and light is more upstream. So you might have heard of photobiomodulation. So photos just light, bio is biology, modulation's changing. So changing your biology with light. And it's actually a very well-researched topic. You know, there's thousands and thousands of studies on PubMed about this topic. And really, like, for thousands of years, light has been used as a healing tool. Like people used to use the sun as a healing tool. It's just common knowledge that that was what you did. Actually, it's called heliotherapy, sun therapy. But other examples, if you think of just common things we use in medicine, like for neonatal jaundice, babies that are yellow when they're born, we put them under light to break down the bilirubin. So that's a common one. And then, yeah, coming from South Africa, I know lots about tuberculosis. We used to, it's a major epidemic down there. And in the old days, they used to put people into these TB hospitals. And before they had all of the drugs to treat it, they would put them out in the sun as the mainstay of treatment. We also use sun therapy on various rashes and skin conditions. And then also many of you might be familiar with red light therapy, which is trending more and more. And that's basically using certain frequencies of red and infrared light to signal healing in the body. So we use it in brain and Alzheimer's treatments, concussion treatments. It's common in like athletic type of injuries, and then also in the cosmetic dermatology world. So this concept of light as a healing tool, it's not new at all. It's actually well accepted in medicine in certain areas. And then just, we both, Rachel and I, mentioned that how light drives biochemistry. So we need to correct light to correct our chemistry. So that's, everything from like hormone production to, even kidney function and what's going on in your mitochondria. That all needs light before the chemistry. And so just to give an example that most people understand is we know that we need sun to make vitamin D. And actually it's a very specific part of the day that you get vitamin D production with UVB light. And so there's a very specific frequency of light where the body knows to trigger that chemical process to make vitamin D. If you go into the sun at sunrise or early morning, you're not going to make vitamin D. So it's the specific frequency that sends that signal. And the same thing happens when we tan. So the sun triggers melanin release, and that darkens the skin. And it also has several other important functions in the body. And then a really important concept to remember about the body is that our cells, like the body itself, emits light signals. So our cells are constantly making light. We also make, that's how the body actually communicates between cells. We emit infrared light, which is why we're warm to the touch. And if you look at the slide, there's one of those thermal images that they use for thermography, breast scanning, and stuff like that. That's the body's light being used diagnostically. And so, yeah, ultimately what the Lifewave patches do is they use your own light to activate healing. So, yeah, it's quite an unbelievable concept. It's quite mind-blowing and revolutionary, and I can see why people think it doesn't sound quite right. But it's actually really simple, and it makes sense when you understand this concept. So, yeah, I'm going to jump right into the patches here soon, but just a quick intro to the inventor. So David Schmidt is the inventor, scientist, and founder of Lifewave. And yeah, honestly, this is just a brilliant man. He's got a brilliant mind and also a big heart. He's really on this mission to spread this technology all over the world and actually make it accessible to people. Yeah, he's passionate about using light and to signal the body's own natural healing abilities. He's got over 150 patents. He's had hundreds of inventions, and then they've done 80 plus clinical trials on all of the Lifewave products. The company's been around for 20 years or so, and it's available in 80 different countries. So it kind of shows how far his vision has reached already. And actually, the first patch that he developed was for the Navy SEALs working long shifts on submarines. So they needed a way to stay awake and alert without taking stimulants. And so he made this patch called the Energy Enhancer, which basically works by boosting mitochondrial function and energy naturally, and it worked. And so then after that, he has created several other patches, and the Energy Enhancer is still around. And but yeah, it was after him launching the X39, which I think was the end of 2019. that the company grew from 20 million to 600 million in 3 years. And that kind of speaks to, yeah, the effectiveness of how it works and how people are finding it transform their lives. So yeah, back to the patches here. So basically you can see the bottom right-hand corner, the patch is about the size of a quarter. You get like a little sleeve there of 30 patches, which lasts you a month. And the patch is made up of organic nanocrystals. So it's basically just amino acids and salts and sugars and oxygen. And they're crafted into sort of this crystal lattice type structure. And the shape of the crystal, the conformation of the crystal determines what information it gives back to the body. So each of the different patches will have different kind of crystal structure. So you wear it straight on your body. You stick it on like a Band-Aid, and what happens is the light that your body, the light and that heat that I was speaking about that your body naturally makes, it hits the patch, and the patch reflects it back into the body. And then the crystal changes the frequency of light to a specific frequency that stimulates processes in the body. And there's different processes, but for the X39, the main patch, it's telling the body to make more of a peptide called GHK copper. And I'll go into that in a little bit. But peptides are basically just short chains of proteins. So it's like a bunch of amino acids together, and they exist in our body already. But they can decline when we've got disease or when we're aging. So we're basically just helping them to optimize and increase production with the patch. And so, yeah, in my work, we've often used peptides like external peptides where you either take it by mouth or put it up the nose or inject it. And there you're putting sort of a set amount of peptide into the body every day and then just letting the body decide what to do with it. But with the patches, you're stimulating a specific peptide depending on the patch. And because the patch is because the body is so intelligent, it knows not to produce too much or too little of that peptide. It's got this sort of modulating effect where it produces just enough for what's needed in the body. And then the important thing also with these patches is they're non-transdermal. So what that means is you're not putting anything into the body. It's not like a fentanyl pain patch or like an estrogen hormone patch where you're putting active ingredient into the body. This is basically just a patch with a specific structure, a crystal structure that's giving the body the right information to do what it knows how to do and heal. And so, yeah, as I mentioned, the X39 is the leading product. And yeah, it's a patented patch. And for those of you who don't know much about patents, they're really very tough to get. And you have to prove that what you're using actually works. So I think this patch is patented for about 20 years. There's nothing else like it on the market. And yeah, there are other companies that claim to be making similar things, but it's just not the same thing. And then they've got several other patches, but the X39 is really the foundational one that everyone gets onto first because we know it's the one that is going to regenerate, repair, and heal based on the stem cell activity. So as I mentioned, it activates that copper peptide called GHK copper. And that's got all the different downstream effects that I'll talk about, including stem cell activation. So yeah, the GHK in GHK copper stands for glycine, histidine, lysine. It's attached to copper. And this peptide, it does decline with age. And basically, in a nutshell, what it does is it activates healing genes and then it calms down inflammatory genes. In fact, it actually resets 4,192 genes to a younger state. And I believe that's within days. And if you remember, we only have about 20,000 genes. So it's at least a fifth of our total genes that get reset. So then just a little bit about stem cells, and most of you probably have heard of them before. They're basically just, they're pluripotent, which means they're kind of like a blank slate. They can turn into whatever the body needs at the time, skin, bones, or organs, or nerves. And so like a basic example of this is you get a cut skin, your body sends stem cells to the area. You can, they basically can transform into skin cells, or if there's a deeper injury, they could make blood vessels or connective tissue. Or if the brain's injured with like a concussion, you'd also get stem cells going there, making new brain cells and supportive cells and healing and repairing. But as you can see there on the slide, they decline with age, and basically, you know, by age 30, you've already lost 60%. By age 60, it's 90%. And so it makes logical sense that, you know, we know they're there to repair and regenerate and like ultimately keep us more disease free when we're younger. And so as we age and we lose them, we basically bounce back slower. Our repair is less efficient. We tend to get more disease. And our body is overall just less resilient to outside forces because it doesn't have the same capacity to heal. And you know, some of those environmental factors that I mentioned before, you know, EMF and blue light and chemicals and all of that, it just makes you know, it can make stem cell decline go even quicker, and it's harder to be resilient in a world where you're surrounded by things that are constantly stressing the body out. So what if we could actually reactivate these cells? And that's what the X39 does. So I'm not going to go into detail here. You can. This is just a table comparing traditional stem cell therapy and X39, because people can get a little bit concerned that, you know, messing with stem cells in the body, what's it going to do? Are they going to cause cancer? Are they going to just, you know, cause other problems? But yeah, with the main things are traditional stem cells. They're invasive. You're usually injecting them. They're expensive, like anywhere from 5,000 to 20,000 for a treatment. They're usually directed in one area of the body, and then you need to see a practitioner to do them, and often that means traveling to another country. And then the X39, it's non-invasive. It's just like a skin patch. It's activating your own stem cells, and it's doing it systemically, so all over the body. It's safe with minimal side effects, and then it's obviously easy to use at home. So yeah, much more appealing than the more invasive option. And yeah, so just a quick summary then of everything I've just said. You've got your X39 that activates that GHK copper peptide that activates dormant stem cells. It also causes, it also reduces inflammation and helps with heart health and brain health and collagen production and mood balancing, helps with muscle strength and stamina, wound healing, scar tissue, hormone balance, and the list goes on. And then, yeah, by activating your stem cells, you also are feeding into helping all of those processes as well. So, yeah, just do these patches actually work? So, as I mentioned, to get a patent, you have to provide evidence that the invention actually works, and you get the results that you're claiming. And other than the patent, there are multiple clinical trials which you can access. I've got a website later on called This Is It Info, and you can check them out there. But basically, these trials that I'm showing here, they've proven that the X39 does in fact increase GHK copper production levels within a week of using it. So there's a couple of those ones. It also increases, it changes metabolism and increases overall protein production. And then also notable effects on brain imaging, quantitative EEG that shows decreased inflammation in the brain. We'll talk a bit about that later as well. And then, yeah, so that's just the summary of what I just said. And I won't go through this table either, but just to mention that, just to kind of summarize that there's even more research on GHK copper itself. And there was a doctor called Dr. Lauren Picard that I think it was decades ago. I forget when he did most of the research, but he showed that GHK copper resets cells to a more youthful and healthier state. And I think this was pivotal information in David Schmidt's thinking about and coming up with these patches. And yeah, there's thousands and thousands and thousands of studies on GHK copper. And so, yeah, ultimately we know that the patches, they work to elevate this peptide, and then we know that this peptide is resets our genes to a healthier state. So yeah, at this point, I'm going to let Rachel go through a few testimonials. It's always great to know the research, but research doesn't always translate into results. And with anything, any intervention I use, I like to always look at, what's the best research out there, and then do I actually see results either in myself or patients? So yeah, the testimonies are absolutely astounding, and I always enjoyed watching them, and they're very compelling. But when I started to see firsthand results in myself and the people I recommended to, my belief was even greater. So yeah, I'll hand over to you, Rachel.
All right, thanks, Michelle. And yeah, like Michelle said, I mean, these are testimonials on slides, that you're just looking at. But again, I would say that medical doctors are one of the groups that is very difficult to convince of things, especially alternative, that work. And there are a lot of medical doctors in this company, functional doctors, integrative, naturopaths, chiropractors, pharmacists, you name it. So it's undeniable when you hear story after story after story, and then you see it in front of your eyes and you experience it for yourself. So I just wanted to kind of preface it. I know you're just looking at things on slides here, but on the left-hand side, I think that this has to do with hair growth. And it might seem like a small issue, hair growth. It's not like it's a disease or anything, but it's significant in people's lives. And, there are people with alopecia who have lost their hair, or, women around my age, the perimenopause and menopause, who, when you take showers, it ends up being like you're pulling chunks of hair out of your head. And so you can see at the very bottom on the left-hand side is probably the most striking image. You can see I don't know if you can see my pointer, but anyways, but on the left-hand side, there's a balding patch of this gentleman. And then on the right-hand side, you can see I can't read the timing here. I know we have another image of someone that is on our team who it was 6 months and there was significant hair growth. I don't know the timing of this one here, but then on the right-hand side, you can see there's graying. A lot of people have had basically their hair going from gray or white back to colored. And you can see this one sort of in the root. I know it's difficult on a computer on a small screen, but the root has that gray line, and then there is no more of that gray on the right-hand side. And on the right-hand image, we have, this was really striking to me as well, a curvature of the spine, scoliosis. Now, this woman said only 4 weeks of using the X39, and you can see the significant change in how straight it is. And we actually have, again, another lady on our team who she's in her 70s, and she has noticed a change in her scoliosis. It's been 4 months for her. But this lady said she's only been using the patches for 4 weeks, and look at the change that has taken place already. I know you can see a bunch of other patches on there. The one that says Icewave, that does not do any of the regeneration. That's strictly for pain. It's just for pain relief on immediate basis. So, and here on the left-hand side, this lady has what's called vitiligo, and it's where there are patches of the skin where there is depigmentation, so there's no melanin. And she said she had tried everything to get rid of her vitiligo and nothing worked. And then you can see on the right-hand side, it's slightly different color, but the important part is that it's a uniform color. There isn't that splotchiness of color where there's a lack of pigment. It's a nice uniform pink color across her whole back. And that was with just the X39. And on the right-hand side, you can see these images, although they may not look like it, they're actually of a knee. I've seen a ton of knee replacements in my career, in my life. And so on the left-hand side, that is an incision after having a knee replacement. And using the patch for only 2 days, you can see the wound healing that has taken place on the right. And that is significant. I can tell you from having seen surgeries for over 25 years, that is a very rapid wound healing. And here this is, you don't have to know the complete details of this, but this is a 77-year-old woman and it is a brain scan. And the way this scan works is on the left-hand side, this is prior to using the patch at all. And there's a lot of red there you can see, and that red actually denotes inflammation. So there's a lot of inflammation. The dark blue means low activity. And what we actually want is more of the light blue and the green, because what that shows is coherence. And what that means is the left side of the brain and the right side of the brain are actually speaking to each other. And we want communication because that's how things work optimally in the body, with the brain and then sending all of the communication to the rest of the body. So you can see the middle image, that's only after 3 weeks of using the X39. You can see there's no red anymore. So there's no more inflammation. There's still some dark blue. There's more dark blue, so lower activity, but there's more green and light blue coming in. So again, more coherence. On the right side, that is only 6 weeks after being on the X39. And again, still no inflammation. There's no red. There's a lot more of that light blue and green that's coming in, very little of the dark blue. So there's a lot more coherence, more communication, meaning more harmony, and that equals better health.
Thanks, Rachel.
You're welcome.
All right. So yeah, I think enough about the science. We'll just jump into some of the practical aspects here, and hopefully you can see this patch is not just a gimmick now. It's actually rooted in science, and we've got thousands of testimonials to say it works. So yeah, how do we use them? We're basically going to put them on for 12 hours in the day. So put them on in the morning, take them off at night. The X39 can be quite energizing, so that's why we don't use it usually at night. There are a few people that do. And yeah, basically put it on in the morning, take it off at night, and then put a new patch on the next morning. And actually wearing it for 24 hours makes it less effective. And this is there's a process called attenuation in the body where, if you give the body too much of one thing and it gets used to it and it becomes less effective. But also you do want to wear it daily. You don't want to space it out. And so it's a bit of a Goldilocks effect where you want not too much and not too little. You do want to put it on clean, dry skin, so no products or creams underneath. But you can wear it when you're showering, bathing, swimming. You can wear it with exercise. There are some people who choose to place it after that, just depending on how much you sweat, but most people don't have an issue with it falling off. And then, yeah, very importantly, you do need to make sure that you hydrate. So actually, the way energy and electrons move around the body, they move through what we call a connective tissue superhighway. So it's basically collagen, and there's these little tubules of water, and that's how energy kind of moves around the body. And so if there's not enough water and hydration, then we're not going to get the same effect. And it's actually, many people have noted that when they get their hydration up properly, the patch works better. And then, yeah, you ideally want filtered water if possible, but you do want to add some minerals to it. And that can be either like mineral supplements or just unrefined sea salt in your water. And that basically makes the water more absorbable and actually gets it into the cells. And then you want to make sure it's consistent water drinking throughout the day, not just gulping some down at the beginning and end of the day. And then lastly, because it's a copper peptide, we need enough copper in the body for it to be able to make the peptide. So best to get this through your diet. Top foods would be things like oysters, organ meats and seafoods. And then for those who are non-meat eaters, nuts and seeds, avocados, and then even just a square of dark chocolate gets you enough copper. And then if you think your diet's not great or you're not getting enough of that, you can supplement with copper, about 2.5 milligrams a day. And then, yeah, when it comes to really wearing the patch over time, it's the consistency is the most important thing. So our bodies take a long time to get out of balance. We need to give them time to regain that balance. And so your body just needs that daily repeated signal to get the healing going. And we want you to commit at least to 3 months of it because they found that 97% of people have an effect by 90 days. And actually, the best way to do it is to wear it for a month for every decade you've been alive. So if you're 44 months, if you're 66 months. And it's important to just remember that healing's in layers. It doesn't always happen immediately. There are some people that we call one patch wonders that like literally get symptom relief within like minutes to hours. But most people, it takes a little bit of time to see change. And yeah, it's because sometimes the stem cells are going to kind of go where they're needed most, and that might not be where you think they're needed most. So they might go down to repair internal organ damage or tissue repair, and yeah, just a little bit of trust in the body that it knows what to do. And then many people do use the patch beyond that 1 month per decade. For me, I'm beyond that already. I'm using it for prevention and longevity at this point, and likely will continue to use it. But yeah, everyone will sort of make their own decision on that. As you can see by the slide, some of the changes that happen do take longer. And so like Rachel mentioned, some of the stuff she saw was later down the line. Usually like organ failure type stuff can take longer, heart function and that kind of stuff, or if there's significant brain issues. So yeah, it's the patches they're working intuitively with your body. So it's really give it time, be curious and track your symptoms, and then allow the body the time and space it needs to get to better health. And then it is suggested to write down your wish list, write down your symptoms at the beginning, and then track them. I always like scoring symptoms out of 10. So like if my fatigue is 10 out of 10 now, but it's 8 out of 10 in 2 months, well, that's an improvement. And so often you can forget what you're going through. And then you look back and you're like, oh yeah, I had severe anxiety and now I can actually like function. And so it is good to objectively put it down. Often family members will also tell you things that you don't remember. And then, yeah, the inventor himself often talks in his talks about, this is one tool. You do want to make sure you're maintaining a healthy lifestyle, good nutrition, hydration, movement. All of those things are going to improve the way that the patches work too. And then, yeah, what Rachel and I mentioned about circadian health and making sure that you're aligning more with nature and getting out into the sun, that also supercharges and gets your mitochondria more healthy. And your mitochondria is where you make the GHK copper. So all those things are really important. And then, yeah, safety, it is something that can be used long term. It's latex free. Very few people have any reactions to the patches on the skin. If you do, you just rotate them around to different areas, and most people are good after that. And each of the patch has a different place where it's suggested you wear it based on the research that was done, but really you can wear them anywhere. Some people wear them on painful areas, or there's a lot of people suggesting you use them on acupuncture meridians. I'm still playing around with that to see whether it makes a difference or not, but yeah, the information's out there. And then you don't need to monitor. It's safe with medication because you're not putting anything into the body. But it is important to note that your medication, you may need less of it over time. So if say you're diabetic and you're on glucose lowering drugs, you do want to monitor your glucose and also be aware of the symptoms of low glucose so that should you need less of the medication, you can wean it back with your provider. Same with blood pressure. Just to make sure that you're staying safe with that, but it's not that it's interacting, it's just making you need the medication less. And then yeah, most people are pretty good getting started on them, but you can get temporary detox signs, and this can indicate a healing response. So your stem cells are going and getting active, and they're cleaning up shop and they're starting to detox. You can sort of get certain symptoms that get worse before they get better. Some people get slightly more pain or fatigue or headache or brain fog. There are various ways to deal with it. You can use the patch for less time in the day. you can, and then just build it up slowly, or there are other supportive patches you can take with it. Also basic things like I mentioned, like hydration can help you avoid that too. But yeah, ultimately you need to just listen to your body and then change your path a little bit if you have to. Yeah, and then I'll just hand over to Rachel just to talk about if people are interested, how to enroll and get going.
All right, thanks, Michelle. Okay, so I know that, so this slide says there are 3 ways. I personally, honestly don't know who would enroll as number one because the price is significantly more. So the difference is you can either be a customer or you can become a brand partner. And the difference, I actually always recommend people go in as a brand partner because there is zero obligation to the business. So I've had lots of people, friends who have zero interest in the business. They just wanted to buy basically in bulk. They got the biggest package, they got everything at once, and you don't have to do anything for the business. You get better pricing. You actually get better pricing. And as a customer, if you end up sharing, people talk, we all talk about what's going on in our lives. We share with our loved ones, close family, friends, colleagues. And if someone then is interested in trying it for themselves, if you're a customer, they can't purchase it through you. You would have to send them to someone else to purchase it. Whereas if you are a brand partner, someone could then enroll you, and then basically you could get it from being a brand partner. And as an aside, as a brand partner, like I got in because my mom, I told the story about my mom and her heart failure and such. And so that was the priority for me. But I really wanted myself, my mom, and my kids to use it. And as I was started to share it, money started to trickle in. And I thought, well, that would be nice even to just have my patches paid for, because especially with inflation nowadays, and the US dollar for us that are Canadians on the call or elsewhere, it does kind of feel like it would be nice to have something paid for rather than money going out. However, I personally look at these as an investment in my health rather than an expense. But again, so the brand partner, you get the better pricing. There's no obligation to the business. You have a place. You can share it with people. If you decide to use it, even if you just want your patches paid for, or if you want an extra few $100s a month, there is an opportunity to use it as a business if you want. And then if you've already signed up as a brand partner, then there's no extra cost. And having said that, there is no extra cost to becoming a brand partner. You are just paying for the product. And as far as I know, I've never been in any kind of network marketing company before, but apparently you have to usually have some buy-in to become a brand partner. This is purchasing your product. That is how you become a brand partner. So the pricing here is for a 30-day supply. And as Michelle mentioned, the minimum that people really should try is 90 days. If people come to me and they say, well, I just want to try a month, then I usually say there's no point in trying it, because if you do a month, you don't see any changes, you think it's not working, it doesn't work for you, that's actually not the case. Oftentimes, I had one of my nurse friends, she signed up because her husband had tinnitus. So he had ringing in the ears that nothing worked. And she trusts me, and she also understands about light and what's going on in the world. And after 2.5 months, she said, Rachel, she said, we're not seeing anything. We're just going to stop. And I talked her into the fact they had a 30 or 90-day supply. They had 3 months worth. I said, just finish it off. You've got it. Just give it the 90 days. Sure enough, actually, within 2 days of her saying that to me, she messaged, she said, her husband, she was like, he was sitting on the sofa and he said, I don't know if I'm imagining this. He said, but my ringing in my ears is gone. So it really is a matter of time. And again, as Michelle said, it's the recommended time is a month for every decade that you're alive. So there are different packages to purchase as a brand partner. I don't know if you had that slide in there, Michelle, but there, okay, yeah. So this is the different, these are the different packages that you can sign up as a brand partner. So the core, for example, would be a starter that would be 3 months worth and $295. So you get all 3 months worth at once. That doesn't mean that is what you would do on a monthly basis. That is just the initial purchase for $295 US. The advanced, say if you've got a couple, there's 2 people in the family, or you've got more people and you just each want to start out with a month and then get on a monthly subscription. This is $535, so you get a little bit of a discount for 6 months worth. And then the premium is really if you do have a full family that you want to get everything in bulk, you want a better discount because this is $250 off US. Again, it makes a difference to us Canadians. And it's for people who are interested in using this as a business as well, because there are some business perks that we don't have to get into. But then you can sign up on a monthly subscription. Again, you don't have to. I just want to stress and emphasize that there's zero obligation to any subscription or anything to do with the business. This really is the best way to get the best pricing.
Thanks, Rachel. So yeah, your next steps would be basically just get in touch with whoever sent you to this presentation, and they can help answer more questions and provide you with more information if you need and get you enrolled if you'd like. I also mentioned that website, This Is It Info. They've got all the research up there, more testimonials and more information. And then, yeah, we'll be hosting more of these. And if you do enroll, there's a ton of supportive Zooms where you can learn everything you need to about the patches or the business or whatever you want. Yeah, it's an amazing community of people that are there to help each other and get this out to as many people as possible. And yeah, so basically, it's a new paradigm of healing, and it's literally not anti-aging, it's age reversal. You're not adding anything in, you're just activating what your body already knows how to do. And when we signal stem cell activation with light, repair can begin, youth is restored, and regeneration takes over. So with that all said, if anyone's got any questions, I'll stop the screen share. You can write stuff in the box if you're shy to speak, or otherwise just yeah, unmute yourself and go for it. So April, hi April. So Useful Kids. So basically they are only approved for, I think it's more than 16-year-olds, but having said that, there are multiple people that do use them for kids, even newborn kids. As far as I know, there's a integrative doctor that has done that for his newborn. Yeah, I always like to just remember that you're not putting anything into the body. And so it's not like taking a supplement or a drug where there's that same risk. As I mentioned, I'm pregnant and I'm using them. Yeah, if there's anyone who digs really deep into things to understand mechanism, it's me. Like I definitely made sure that it was a safe thing for me. And yeah, I've been on it throughout the pregnancy. So I would personally use it on kids, but just the company's not able to recommend that. And then Nancy hi Nancy. Is it safe for anyone? Autoimmunity, can it be used long term? Yeah, so basically, yeah, again, because you're not putting anything into the body, it is really safe for anyone to use. It's people are using it long term for years and years already. Commonly used in autoimmunity as well. With autoimmunity, there are other patches that we sometimes add on to X39, but X39 alone is a good start for that. And then, hi Marcia, how often should you monitor thyroid function once you start the patch? So yeah, with thyroid function, I would aim to do it at most 3 months but even as much as little as 6 to 8 weeks, I would also just be aware of, the symptoms of high thyroid, racing heart, feeling sweaty, anxiety, not sleeping well. If you feel those creeping in sooner, then I would get the lab test done sooner.
And just Michelle, there are countless stories of people getting off their thyroid medications. Countless.
Anyone else? Yeah, and definitely if you think of questions, feel free to send us messages afterwards.
Hi, Michelle. This is Kate. I was wondering if I could ask a question.
Hi, Kate.
Hi. I have a patient who's suffering with extreme fatigue going through cancer therapy. His real goal is in life, he's 82. He just wants to have some kind of quality of life. Do you think that this could be somewhat helpful for him, and could he use it in conjunction with his chemotherapy?
Yeah, so there are also countless testimonials of people using during cancer and cancer therapy. Yeah, in terms of like how it'll improve his function right away, it's difficult to say. You can't really guarantee timelines or anything with people, but the way that it works, if we're increasing stem cells, they're going to go to where they need to go to heal and repair. So yeah, there's many similar stories of that kind of thing where it's helped people.
Can I just add one thing, Michelle?
Yeah.
The one thing that David Schmidt does make sure that he says for patients who have cancer or people who have cancer and are on chemotherapy to check with the oncologist, because most oncologists, if someone's on chemotherapy, don't want them on any antioxidants. And because the patches, the X39 increases glutathione, which is an antioxidant, that counters what the chemotherapy, like it's basically helping and boosting your own immune system. And chemotherapy is just a destructive process to healthy and damaged cells. That's just one thing to keep in mind. But again, for me, I would do it. I know lots of people that would be using them, and lots of people do. It's just depending on the relationship they have with the oncologist and what is taking place. So just to keep that in mind.
Yeah, and I think I've heard of people using it leading up to the chemo and after, maybe just not using it on the day, for example. So it's the same thing, Kate, as some of the supplements we would recommend, and taking glutathione supplement, you can do it around, but not maybe on the same day.
Great, thanks.
Peggy, hi Peggy. If you're taking two patches, do you use them at the same time, or 12 hours for one, 12 for the other? I think you were recommended the X39 and the Eon patch. So those ones you can use at the exact same time. The Eon is actually one that can be used in the day or the night. So you could wear them at the exact same time. You put one at the back of the neck and one under the belly, for example. And then certain people find they're great for nighttime because it balances the nervous system and can help with sleep. So you can play around where you do 12 on with the X39 and then 12 on with the Eon at night. We'll just use them both together. And there's certain people that are using 4 to 5 patches a day, probably me and Rachel included. Anyone else with anything? Okay. Well, if there's nothing else, we'll say good night. Thanks everyone for being here. And yeah, like I said, just reach out if you think of other questions, and look forward to hearing from you. Hope you all have a good night. Nancy, how would you prefer we contact? Just straight through Instagram for now, and then I'll get in touch with you